What we've just done is we've just gone over cannabinoids, cannabis, and the endocannabinoid system very, very quickly. This video, plus other videos that we've done in the past, are available on youtube.com at Marijuana Aware, where you can check out not only this video, but other videos that you'll see in the past and also coming up this quarter. Let's jump to the questions, if you don't mind. I'd like to be able to dive right into those. First question is, will there be specific recipe for pain management? And the answer is yes. Cannabis is extremely, let's just say, good at relieving pain and being able to help you control it. I have, for example, 7 herniated discs in my neck, and that's instant pain. And I've been able to, over the last 7 years since my accident, I've been able to manage that and keep my pain level down to below a 1, which is very important to be able to just conduct my business and lead my life. I should point out that a lot of what helps with cannabis is the terpenes. And if you look down here, you'll see the various terpenes right over here. And you notice that they have anti-inflammatory as well as pain relieving capabilities. And I should point out one of the things that CBD does is it's a great anti-inflammatory. And what happens is if you can reduce the inflammation in your body, or you can reduce the inflammation in a particular injury, it'll reduce the pain. So a lot of people are claiming that CBD is great for pain management, and it does help, but it does it by doing it by relieving the inflammation, not necessarily by addressing the pain itself. THC does a great job of addressing pain itself, but it does it in concert with the terpenes that you see here. So yes, the answer is yes, there is a specific recipe. And I should point out that when you're looking at addressing pain, you have routes of administration. Routes of administration are how do you use cannabis? Do you smoke it? Do you use tincture drops? Do you use gummies? Do you like chocolates? Do you take capsules? Do you have patches? There's a number of different ways of taking it, and they all have different onsets, which means how long does it take to work, and they all have different durations, which means how long do they work. So things like vape pens, things like topicals work almost instantaneously. Will work within 5 minutes, and you'll feel the relief right away. Where you take something like capsules, or you take edibles like gummies, the famous gummies and the famous cookies and things like that, they could take an hour or two to work. And so you have to be very careful when you use your routes of administration. Know the onset and, more importantly, the duration time. But the answer to your question is yes. There's very specific pain management. You call it recipes. We actually, in the cannabis world, call them cultivars. Cultivars are products that are made targeting very specific conditions. So there's a combination of the terpenes and also the cannabinoids together to address a particular condition. And when you go to your dispensary, what you'll be able to do is talk to them. You'll be able to ask them questions about what products they have, but more importantly, they'll be more than happy to direct you to the products that have the specific terpenes and the specific cannabinoids to address your pain management issues. Let's run into the next question, which is a very good question. What terpenes are good for neuropathy? Now, neuropathy is very interesting in that it's a problem where the sheath in your nerves are basically being broken down, eliminated. And one of the interesting things is a number of cannabinoids have what they call neuroprotectant capability. We talked about that in the presentation itself. This neuroprotectant capability will not completely replace the sheath that's on your nerves, but it does a good job of protecting it, putting it, like in essence, an emergency blanket around it so that it does relieve the pain that's really out there. I tend to look at cannabis from a terpenes standpoint as to what terpenes are actually being used to be able to address that particular condition. And this is where terpenes like limonene, pinene, linalool, beta-caryophyllene, eucalyptol, and bisphol is something that can help you quite a bit. It's also, when you're talking about neuropathy itself, be careful of not using terpenes like linalool, myrcene, terpinolene, germanol, borneo. They actually won't necessarily help you, but it may bring on some of the conditions that are really out there. When you're looking at choosing the right product, you're looking at something that has analgesic capabilities, antibacterial capabilities, something to elevate your mood because you're obviously in pain. You're looking for neuroprotectant, which is really, really key, and something that can really help with stress and anxiety. Yes, there are terpenes that are good for neuropathy. Let's run into the next question. If you live in a state that does not offer medical marijuana, how are you able to acquire some? I'm in Tennessee. Unfortunately, the way the laws here in the United States work, and I'm talking from a legal standpoint, you literally cannot get medical marijuana in states that have not passed a medical marijuana program. So I don't have any fairy dust or any magic wand that could be able to get you medical cannabis in those particular states. Now, I do know that there are certain bills that have been signed. I know that there are THC and CBD products that are out there that can help. I do have to tell you that CBD products are usually also being made from hemp, and hemp is a product that can be sold legally in every state. So if you're looking at using a medical cannabis product that is legal, you might want to look at hemp-based CBD products. Now, CBD is great at managing inflammation, and that does relieve a lot of pain. Now, let's jump into the next question. What are the benefits of CBDA as opposed to CBD? And what's interesting is when you take a look at CBDA, now what happens is it has a lot of the similar properties to CBD. Okay, in other words, it because it is the mother or the precursor of the actual CBD product being made itself, it does have a presence. It is available in the cannabis plant. It's basically available in higher concentrations when it is in the raw form, meaning when you buy the flower itself. You buy flower at a dispensary, that flower hasn't necessarily been converted, it hasn't been heated. So the THC, the CBD, the CBC, and the CBGA haven't been converted yet. It hasn't been decarboxylated. Research has also shown that it is better at handling and at addressing inflammation and also nausea than CBD itself. So it has really good medical properties without some of the negative side effects that you might find. And there's not a lot of negative side effects to CBD, although some people have a CBD tolerance. And people that have CBD tolerances find that CBDA works for them, but CBD doesn't necessarily work. And that's something I do want to point out. It's really a more powerful anti-inflammatory than CBD, but CBD itself also brings some other properties to it that where it is addressing. CBD itself addresses other receptors other than the CB1 and CB2 receptors, and that's where CBDA does not do that, but CBD does. Let's jump on to the next question, which is what terpenes are best for arthritic pain and for muscle pain. Pain is something that you have to manage, especially as you get older. And arthritic pain, unfortunately, comes with just too many years of playing athletics and just getting older. That's the way of putting it. So what are the best terpenes for that? Well, there's a couple of them that I highly recommend, which is linalool, myrcene, and caryophyllene. It's also called beta-caryophyllene. I should point out pinene is excellent for helping with pain and for pain management. But there's a caveat to pinene, and that is it brings back short-term memory. So if you're suffering from something like PTSD, be a little bit careful using pinene because it may bring back some memories and some thoughts that you don't necessarily want to have come back. Also, the route of administration is really, really important. I found that products like topicals work almost immediately. And so if you have pain and you put the topical that particular area, you'll find it works almost immediately. And you'll find that in topicals, you have your standard topical, which works on the surface of the skin. And then you have transdermals that go through the blood-brain barrier to actually get into your system and really help you get deeper relief. Tropicals are very good. They only last they work right away. They'll work within 5 minutes. They only last between an hour or 2 hours, except if you get a transdermal patch. And those transdermal patches can last anywhere from 8 to 72 hours. The route of administration is as important as the actual products themselves. Now, naturally, if you're looking at using inhalation, which is smoking the product, vaping the product, or using concentrates, which you'll find that works almost immediately as well. Again, the duration for that is between 1 to 4 hours, depending on your metabolism. But if you want longer lasting effects, this is where you want to take a look at using products like the gummies, like the tinctures, and like the capsules that are out there that can help you quite a bit. It's something that is very, very important. Cannabis, one of the main reasons why people come and use cannabis is because they're trying to address pain management. Pain management and anxiety and stress are really the two main reasons people use cannabis. And really, this is something that's really known for. And by the way, it does a great job. I couldn't live my life the way I live it, which is to run a pretty close to normal life without cannabis itself. Let's jump into the next question, which is what do I do needing to take higher doses as my body gets used to cannabis? This is a fantastic question, one that everybody should understand. We have something in the medical cannabis world called tolerance breaks. It could be called tea breaks. What it means is you take a cannabis holiday. What happens is your body produces endocannabinoids. When you have a problem, let's say you hurt your knee, you have a stomach problem, or you have your body gets out of balance for some reason, it sends a signal to your nervous system, to the brain that says, Houston, we have a problem. Houston then goes to the endocannabinoid system and says, we need to be able to do something here. Your body then produces endocannabinoids and sends it to that part of your body to address that particular issue. Pain management, stress, anxiety, whatever it is. If you don't have enough endocannabinoids in your body, this is where adding phytocannabinoids, storing them in your fatty acids, and when your body needs those endocannabinoids, it then extracts those phytocannabinoids from your fatty acids, converts them to endocannabinoids, and your body now has the resources it needs to provide the to provide the relief you need for that particular condition. And this is very, very important. It's kind of like having a set of batteries ready to go when you have a particular problem. It's really there to be able to help you quite a bit. Really, anybody over the age of 55 can really benefit from using at least CBD, if not medical marijuana, to handle things like pain management, arthritis, all the stuff that as your body starts slowing down, it really helps you overcome a lot of that. Now, here's the problem. If you take it all the time, the endocannabinoid system in your body goes, hey, I'm getting help from the outside. I don't necessarily need to make as many cannabinoids as I should, or I have to. It actually gets lazy, which is kind of interesting. And what they found out is if you take between 1 to 5 days off, it's recommended that you take 4 days off. What happens is your body completely resets. It resets back to pretty close to where it was before you started using cannabis. And then when you start using cannabis again, you'll notice three things that happen. The first is that the cannabis that you use will be much stronger. You need less of it to be able to get the same amount of benefits from that. You'll find that it's more effective because your body now is starting to trigger its own endocannabinoids and starting to process endocannabinoids more effectively. And the third thing you're going to find is that it's something that you can control. You can control when you take your tolerance breaks. I take tolerance breaks every 6 to 8 weeks, which is every about a month and a half to 2 months. And it works very effectively for me. I found that, again, if nothing else, it saves you a lot of money because you're not using as much cannabis to get the same amount of benefits, but also it really helps quite a bit. Now, I should say there's a couple of conditions, which is cannabis use disorder, for example. And if people would have followed these tolerance breaks, if people would have used tea breaks, it would avoid a lot of those particular problems. This is a great question, and I recommend anybody using cannabis for medical reasons, every 4 to 6 weeks, take between 1 to 4 days off. Now, I will caution you, in my particular situation, I can take about a day, maybe a day and a half off. After about a day and a half, my neck taps my shoulder and says, you better do something pretty quick, because otherwise we're going to come back and let you know that we're here. I can't last 4 days. It just isn't in my DNA. So really use the break based on your condition as long as you can tolerate it. Let's take a look at the next question, which is how can I treat neuropathy, Raynaud's disease, and fibromyalgia with cannabis? Is it possible to treat both at once? And the answer is yes, it is. In both of these cases, you're dealing with situations where you have the nervous system, your nerves are being attacked. They're being broken down. There are some medical issues coming into play there. We should point out, now this slide is very busy and hard to see. When you get your email from us, you'll be able to have a flip book you can actually flip to this slide and be able to read it and dig down on each of the different things that are there. But I should point out the answer is yes. Neuropathy can be addressed with medical cannabis and also fibromyalgia, and fairly effectively. And it's a function of paying attention to, again, the two things that are really important: the terpenes that are there, and again, this is the limonene, pinenes, linalols, myrcenes, caryophyllene, terpenolenes, and borol. And the other thing you want to pay attention to is your route of administration. When you're looking at these particular conditions, if you're using like a capsules, for example, or you're using an edible or something like that, it could take an hour to an hour and a half to work, maybe even 2 hours. And so when you have neuropathic pain or pain from fibromyalgia, it hurts, the best way of putting it. But don't go don't wait 15 minutes and take another one, then 15 minutes and take another one, because after about 2 hours, you'll have been taking too much cannabis. People have a heady feeling. Now, let's jump into some questions that were asked live during the webinar itself. When you buy flower, how do you know what terpenes are in it? Well, that's an excellent question. That's why I produced and showed you the certificate of analysis, the COA. Here in Florida and basically across the country, almost every state that you're out into, if you have a medical cannabis program, they require the dispensaries to have what they call certificates of analysis, those COAs. That COA will list cannabinoids, but also the terpenes that are in the product. So what I'd like to point out is COAs are really the way to go. You can get them if you go to the dispensary. You can ask the bud tender for a COA, or if you go online, a lot of the dispensaries will have their COAs for each of the products when they actually list the actual product itself. You'll see the actual product, they'll describe it, and they'll describe the terpenes, and usually there'll be a little label in there that says the certificate of analysis, which you can download and you can actually take a look at. And most of these are in what they call PDF format. When you buy flower, you will find that you can find out about the COAs just like anything else that's really out there. Question is it true that the higher percentage of terpenes, the better, and 3% is better than 1%? Well, first of all, terpenes aren't in high concentrations like cannabinoids. but they are very, very powerful. They're extremely powerful. And so what I'm trying to point out is that you may not get a high concentration of terpenes, but the terpenes that are there are very effective. The answer to your question is yes. Like anything else, if you have more of a terpene, more concentration of that terpene, it will be better for you than a lower concentration. Although pay attention that 1, 2, or 3% is a pretty high concentration of a terpene. Now, another question that came up is I've heard that people with predisposition towards mental illness get paranoid, psychotic, or both using CBD and THC. Is that true? Is it because the endocannabinoids and the phytocannabinoids are chemically similar? Phytocannabinoids and endocannabinoids are chemically similar, but the mental part of it, the paranoia and the psychotic part of it, really comes from the effect or the reaction to THC, which is something that is different in every person's body. And I should point out that that is something that is a natural process because that THC, what it's doing is it's addressing the pain management that's inside your body. Now, if the question is if you're predisposed to paranoia and psychotic conditions, does it trigger it? The answer is it could. There's no really effective. When I went and I looked at all the studies that are out there, most of these are what they call anecdotal studies, meaning they've gone out and they found folks who have used cannabis and they basically put together questionnaires and gathered that information. And they found out that yes, that if you have a paranoid condition, it can in fact be increased by using CBD and THC, although that's not necessarily a given. It depends on the actual person themselves. I would say the answer is it depends on yourself. Cannabis is an extremely personal situation. Every person's body is different. The amount of dosing that people take, what works for me as far as how much I take, is very different from what, say, my wife or my friends will take. The size of your body, the condition of your body has little to do with your metabolism and how it processes endocannabinoids. And what I'm trying to point out is most of the reason why people have these particular reactions to cannabis more has to do with their metabolism than it has to do with their mental condition. I hope that helps answer that particular question. Another question that comes up is how long does it take for marijuana to clear your system? Well, there's kind of a pat answer to that, and that pat answer is usually it's about 60 days. And I should point out whether you're using CBD or you're using THC or derivative products thereof, it's the same. A lot of people have this perception that if I use CBD and not THC and I get tested, I'll be okay. And the answer is no, the CBD will show up. But I do have to point out, again, it'll be in your system for at least 60 days. And I should point out also, drug testing systems are getting much better. If you're doing a normal drug testing system, that's where the 30 to 60 days to get it out of your system comes into play. If you're applying for a job like a TSA agent, or you're going to go in, you're trying to get into the military, or you're looking at becoming an Olympic athlete, they have more stringent tests for drugs than they did before. And they'll pick up the marijuana if you've used it even a year ago. So I should point out that how long does it take to clear your system is really a function of the testing system that they use, how much you take, and of course your metabolism itself. I would use as a general rule, the general rule that you talk to in most practitioners is about 60 days. But again, be very, very careful of really that's out there. And also pay attention to the groups that are working with you. I know that, well, listen, I hope that this has been informative for you. Cannabinoids are very, very important. The endocannabinoid system works in concert with your nervous system. These are interconnected. They pass information back and forth. And it's interesting that we only found out about this, really started researching it in the 60s. It started coming out in really the 90s, and we have a lot more information about it now. And it does a lot to explain how your body works and how products actually work themselves. And I should point out, if you're looking at trying to get a medical marijuana card, again, I mentioned I would recommend using MMTC of Florida. They not only help you do a great job of getting your card, but also they walk you through and support you in your medical cannabis journey. They help you with get the right dosing. They also have an email system every 2 weeks that helps you walk your way through this process. So you're using the medical cannabis effectively, and not a lot of the doctors have the ability or the size to be able to do that. I should also point out one of our sponsors, which is Air. I highly recommend them. For one of my main reasons is because they have terpenes in all their products. Whether you're using a tincture, whether you're using a vape pen, a concentrate, they have what they call ratioed products, meaning they're using CBD and THC in all their products, and they're giving you the best possible experience that's really out there. And I should also point out that We appreciate you watching this particular video. I want to thank you for watching the video and hanging with us tonight. And if you want to find out more about not only this particular subject, it'll be posted on YouTube. And our next video is going to be next week, next Wednesday. It's going to be on THC, THCA, and THCV. Please join us. We feel that it would be, it'd be very informative to really dive down into those cannabinoids. And also, if you notice, our schedule this particular quarter, we're going to be talking about CBD. We're going to be talking about some of the minor cannabinoids like CBG, CBN, CBC. We're going to talk about tinctures, topicals, inhalation, and edibles. We'll hopefully arm you with information you need to be able to help you get your life back. Thank you very much, and we look forward to you joining us next week.